The African Union Specialized Health Agency, the Africa Center for Disease Control and Prevention Africa CDC, has officially handed over the Public Health Emergency Operations Center and donated ICT equipment to Ghana Health Service through the Ministry of Health at Pantine here in Accra to enable the country monitor and fight disease outbreaks in the country and bolster health security. The African region faces over 100 health emergencies annually, stretching health systems to their limits and threatening millions of lives. From devastating disease outbreaks to complex humanitarian crises, these emergencies disrupt progress and deepen vulnerabilities. Speaking at the handing over ceremony in Accra, Minister of Health Honorable Kwabena Mintah-Kando noted that the equipment will enable Ghana to respond swiftly to health emergencies, ensuring no community is left behind in the country's quest for universal health coverage as outlined in Humanization Agenda 2030.
We are privileged to receive this gesture from Africa CDC to set up Public Health Emergency Operations Center, where we'll be coordinating all outbreaks as and when it happens. And for me, it is very important because this will we've been doing it, but it will deepen it. This will help us to be able to take decisions that are, driven by data and that are backed by science. So basically, it's a very good initiative. And one of the issues that excites me most is the fact that the coordination is not going to be restricted in country. It is going to be a coordination across the sub-region to learn from each other, to know what is happening, in other countries on the continent, on the globe, to be able to know how to respond to emergencies in the country. So that Africa CDC has done for this country, they've been providing us with equipment, capacity building, surveillance, training, research, and so we are so excited about their collaboration. Thank you. It's our entire responsibility to make sure that we sustain this system. After all, it was our responsibility to set up the place in the first place. So once they've been able to help us to set up the place, it is also our responsibility to make sure that the place is sustained and it achieves its purpose. So we'll have our eyes on it to the extent that there will be that kind of connectivity or connection from the Director General's office to the center, from the Director Public Health Service to the center, and even to the Minister's office. You have a dashboard to be able to determine and to detect as and when there's an alarm, for the minister to be able to advise the president appropriately and for the appropriate actions to be taken.
Womi-Eteng Oboma Eteng, team lead, country support and capacity building, said this staggering loss underscores the urgent need for robust systems to prevent, detect and respond to public health threats before they spiral out of control.
That said, to go into the details of what had been provided, Minister, you will find an operations room, which is where the technical teams led by the EOC manager will be seated to always analyze data and project data. Collect data, analyze it, and then project. And they'll be monitoring the data to see, for example, if there are early signs of AIDS epidemic in Ghana. There will also be opportunity to connect with other member states through our regional office and through Africa CDC. So a network of EOCs where we can share, for example, early signs or outbreaks happening that could be a threat to the Ghanaian citizens. So this is an important part. We've also provided office spaces with all of the equipment, and it's safe to say state of the art in terms of investment, both the laptops, the sitting area, the teleconferencing materials, and the server room, which is also part of the connectivity that is needed, and then the meeting room where at the level of, if we have the privilege of the president or the minister in emergencies, there's a space for engagement related to public health. This is how much has been invested courtesy of our funding partner, the AFDB. We continue to advocate through the Africa what can be done. Last 2022, for the first time ever, Dhaka, we had heads of state seated in a room away from plenary to discuss one agenda, and that was EOC. Today we call it the Lusaka Call to Action on Strengthening Public Health Emergency Operations Center. And they did recognize that widely distributed. They did recognize the value addition of the EOC, and the mandate was all member states on the continent from 2022 until 2026 invest in establishing facilities like this, and making operational those facilities and report back to us. So by the next year, we will be reporting back to the AU on performance of that